Butterflies in your stomach before a first date, the tension you feel before an exam, the way your heart pounds when you have to speak in front of an audience. Sounds familiar? We like to call them symptoms of anxiety. You may know it as symptoms of stress or stressful symptoms. Anxiety rouses you to action. It prepares you to face threatening situations. To talk more on this topic, I am joined by Professor Raveen Hangwalla, Chair Professor of Psychiatry at the Faculty of Medicine, University of Colombo. Hello, Professor.
Hi, Suhashini. Thank you.
Can you tell us, is there actually a difference between stress and anxiety?
Yes, there is a difference, and there are similarities also. Let me explain. So stress is our body's natural reaction to when faced with a challenge. So the challenge can be mostly an environmental challenge. For example, as you mentioned, the exam can be a challenge or public speaking. However, anxiety is more the response to an internal, shall we say, internal threat mode, where we sometimes, there's nothing visible, but we think of something as being a threat, even a memory or an image. Also, sometimes anxiety can occur without any visible evidence of any threat at all, actually. Sometimes there isn't even a mental threat that the patient can identify, but still you get the same symptoms. When I say symptoms, the symptoms are mostly mediated in both stress and anxiety by a system we call the sympathetic nervous system. And that's the system that makes your heart go faster, your breathing becomes fast. You have this sense of that you're out of breath maybe sometimes, and you start sweating. So all that is mediated by this system. So the visible kind of symptoms or the body's reaction is the same in both. However, anxiety is a response to a different kind of stimulus. So that's the difference. And also in psychiatry, the disorders of anxiety are different to the disorders of stress. Of course, you'll understand more when we talk about stress disorders in a later video. So I think that's about kind of the differences and also the similarities. And also the management strategies are also overlapping, but however, they are not quite the same. And anxiety disorders, obviously, as a disorder, have medical and other pharmacological interventions, which are also used. Whereas in stress, there isn't much of pharmacological intervention. We get a normal reaction of the body. However, when it's excessive, of course, it can cause problems and cause impairment. So therefore, the management will be to contain stress rather than eliminate. But anxiety is a normal reaction again. However, that can lead to disorders which can be managed with medicines and other forms of psychotherapy. So these are some of the differences and the similarities. I hope it will become clearer as we go along in the video.